Hypertension, the meaning means high blood pressure. Let me quote again. It is an intelligent physiological expression of our body to a perceived threat, which can be physical, chemical or emotional. Okay. So there is a threat to the body. Okay. Here I will have to elaborate a little bit. I will deviate slightly. Our body has got control, the whole body is controlled by a nervous system, the nervous system. And the important component is known as autonomic nervous system or automatic nervous system. Without our knowledge, it will take care. அதுக்கு வந்து you have sympathetic and parasympathetic னு ரெண்டு group இருக்கு. Okay, sympathetic is always emergency, fight or flight. Parasympathetic rest and restoration. For example, day you are active, you are sympathetically driven more. Night you are sleeping, you are parasympathetically driven more. Okay. So what happens? Anybody with high blood pressure, the so-called within quotes high blood pressure, go to the doctor and say you have hypertension, meaning you have a disease. Failing to understand, it's not a disease, it's just a symptom. Okay, what you have to find out, if this person has been having some either physical, chemical or emotional injury. Because whether it's physical injury, somebody punches you, or a chemical injury, you take a toxic food, or an emotional injury, some family death or financial loss, the body perceives everything as the same and reacts accordingly. So in an emergency, what do you want? You have to be alert, okay, mentally and physically alert. So all the blood, it has to be shunted to your brain, eyes and extremities. Okay, that's what happens. So adukku vandu the sympathetic overactivity is there. The contrary happens when you rest. The parasympathetic activity takes over. It shunts all the blood from the periphery into our intestine for the digestive functions. Okay. So a person with hypertension or diabetes or anything, they are sympathetically driven. They are in high stress. Body perceives as stress. Okay. It has got to pump more blood to the extremities. The heart has got to pump with a greater force to mobilize this blood all over the place. After all, what is the role of blood? To transmit nutrients, oxygen, to maintain the pH, to transmit hormones. It has got a host of other functions. For that, the body has got to pump with the heart has got to pump with the greatest force, and that is expressed as high blood pressure. So it is an intelligent expression, physiological expression of the body to a perceived threat. The threat stimulates a cascade of products in our body, which is shown as the elevated blood pressure. So you say it's a disease and give a tablet. What happens? People with high blood pressure would always experience the pressure will come down. After all, the body is intelligent. The body will take the pressure up again. That is why you see people from no medicine to one medicine to multiple medicine going on and on, okay, until they get into major issues. So any person who is treating, for example, I am going to treat a person with high blood pressure now, I have to be like Sherlock Holmes, try to look out what are the problems he is having. Is it a physical, chemical or emotional, or certain deficiency? For example, vitamin D3 kammiya irundha your pressure is going to be high. So andha mari we have to look into you have to take the individual as it is, get into all these things, find out the cause, correct the cause, the pressure is going to come down. This has happened practically. I never thought I will do this for my hypertensives. Though initially I was confident of doing for my diabetics, I was able to succeed. But the collateral benefit was people had high blood pressure, diabetes, it became normal. After all, the cause is same. The cause is maybe physical, chemical or emotional injury. The results are, instead of one branch, it's got multiple branches. As Sudha had, she had hypertension, she had diabetes, she had cholesterol. There are multiple branches. Okay, once you cut the root, everything becomes normal. So this is the collateral benefit. I never thought that will happen, but that's the learning curve for me. I understood, no, this can be managed without any medicine. So hypertension does not require any medicine. It has been dubbed as a disease so that pharma industry can produce chemicals for that. Chemicals can be patented. Food cannot be patented. So there is money, huge money. So when you knock off diabetes and hypertension without medicine, the medical industry, the pharma industry will simply collapse. Don't worry. Don't worry. That's not going to happen. Hypertension, like here I would like to make two examples, two major studies. One is known as the Helsinki businessman study done in Finland, and another one UK MRC trial in the UK. In the UK MRC trial, that they took 9,000 patients, two groups. One was intensively treated for high blood pressure, another one they are given advice. Okay. In the treated group, 452 people died. In the untreated group, 448 people died. The difference of 4 statistically insignificant. Whether you treat high blood pressure with medicine or without medicine, the end point is the same. That is heart attack, stroke, sudden death, kidney issues, they are all the same. So when I treat a person with high blood pressure conventionally, give tablet, the pressure comes down, the numbers come down, the doctor is happy, the patient is happy, but the end point there is no difference. That is what that study proved. Helsinki businessman study is even worse. They did the same thing with a group of high risk individuals, high pressure, high sugar, high cholesterol, everything was treated. The other thing, advice was given. There is more mortality in the treated group. So what's the underlying message? Drugs kill people. Because the complications of drugs, the long run, are more than their benefits. This is proved, this is not coming out, thanks to the industry. So hypertension does not require any medication. It can be managed without medication. After all, when you change the diet, what happens? You lose weight. Once you lose weight, BP comes down. You go to any doctor, any conventional doctor with high blood pressure, one of the advice they give, sir, you 10% weight kuringa, seriya poidum. How only he will not be able to say? I do not know. The doctor does not say. So hypertension does not require any medication.